Hi, this is Ed Tracy, and I'm here in Vigo County, Indiana today, and we're here because my friend Dr. Patel invited me up here to come and take a look at his very innovative new access to care clinics that he started here, and I think it's not only a game changer, I think it's a life changer for a lot of people, and the more I learned about it, the more I wanted to come and see it. And we talk about access to care over the past couple of decades here has been a big debate in this whole country. And I think that Dr. Patel has come up with a solution to give people that access for companies that are self-insured, whether it's county governments or school systems or private industry or large groups. But the thing that most interests me is that your first client was the school system here in the county,
That's right.
and Mr. John Orr here, who was the director of I have it written down here. Let's see. I'm going to cut to John Orr was director of we have John Orr here, who was the director of human resources, and I'm going to let Dr. Patel just start by saying, you know, what you wanted to present and what it was that you saw that could help the school system that made you want to do a presentation to Mr. Orr and his group.
Sure. I think working in the healthcare industry for years, especially in the ER, I noticed that we really sort of took care of our part, and everyone took care of their part, and then there was disengaged healthcare where I didn't communicate with the surgeon didn't communicate with the pulmonologist and the internal medicine docs and primary care docs and so forth. So there's really no hub of information. There's it's scattered, so to speak. And now you have a patient that's lost in the system because the information is scattered. What I really want to do is kind of go embrace a group like the school corporation who's privately insured, who really, it's in their best interest to get people healthy. Get their healthcare in order, and get them to even have access to healthcare, because there are a lot of employees, even though they may have coverage, full coverage, but then every time they come in they have to pay a $50 or $25 copay, insurance, and so I think sometimes what happens is we feel like we have employees that are insured and have access, but they really truly don't. There's X percentage that just won't go. So what we developed is that, what can we do for the patient? How can we get the patient to a clinic same day? Get to no waiting room. Get to the doctor and spend 20 minutes with the doctor. There's no copay, and then when they go back home, they will have prescriptions that will be filled right there in the medical home, so they don't have to go outside looking for prescription, 2-3 hours spend time there. So we actually, when you look at the problems overall people are having, you ask anybody, I mean, you ask your mom or my parents or anybody, they'll say the same thing. It takes 2 weeks to get an appointment, 2 hours in the waiting room, 2 minutes with a doc, $20 copay, and 2 hours running around the town looking for prescriptions. So we really wanted to resolve all of this, and we have, and we can, and that was the sort of the focus or the drive to do this. Now, looking at it, that it would work great, but looking at it the business standpoint, now you have the CFO in the room that's saying, how much is it going to cost us? And if I can't show savings, if we cannot create savings, it's not going to work. Then it is truly a dream or a fantasy. So I think what now we did was we said, okay, where can we cut waste? Where is the waste today in healthcare? So we were able to say, when I went to John, I said, look, if we can take the labs, and instead of doing it at this facility, which costs say $270, what if we did the same lab for $18? Well, now we eliminated all that waste, so there's a savings. Prescription, very similar. If you were to get a Z-Pack, it's say $35 right now. So CVS is going to take $10 copay, $25 John Orr is going to get a bill, and he's going to pay because it's self-insured. So CVS is happy, or Walmart or Walgreens, whatever that may be. So he's out of pocket 25, the patient's out of pocket 10. What if we can get the same Z-Pack for $6.25? Now they're out $6.25, not $30. Patient zero copay, so they're happy. So you have happy employees, and now we're showing them how we can save money. But there's two folds. I think people get lost in savings money. I think that people are like, oh yeah, I gotta save money, I gotta save money. But I think the initial stage that we can save money is, I always say that's really just to keep the boat afloat, to show the savings that we can produce in terms of labs, pharmacy, and the decreased visits in the primary care office. But the real savings, we can't even measure them. Those are the ones that individuals who lose weight, individuals who stop smoking, cholesterol is better controlled, the calcium hemoglobin A1C is better controlled. Those are the ones it's hard measured right now because it's going to take
That's
4
more
years.
of a productivity measurement than it is anything else. That would show up on your side with not we talked about earlier at lunch, and I also want to introduce at this time Jennifer Bowling, who's the employee benefits manager in the school district. But John, we'll start with you and say, what did you see when this plan was brought to you? Did you think it was like a dream plan that couldn't happen? Or because I think it would have been my first reaction. My employees are not going to miss work. They're going to not have to have co-pays for medicine or doctors, and be more productive. That had to seem like a dream to you.
Well, as an employer, you're always looking at how do I reduce the bottom line in terms of how much we have to pay out for employee health benefits. And our particular organization at one time was around 3,000 employees plus. And so that was a significant part of the budget. And so we continually looked at what we could do. And there's only so many things you can do with bidding things out and costing and going to cost plus and all that. And it comes to a point where we cannot do the same thing we've been doing and save any more money. I mean, there's just no way to do it. So what else do you have to do? Well, then you look at new radical alternatives, and this was a radical alternative when it was presented to us. And skeptical, oh yeah, because I'm not an expert in that area. And when you hear that from a medical provider that we can do this, and this person's in that system, you're thinking, now there's got to be something else in here, because it just doesn't work this way. But I'll cut to the end of this. It has worked this way. It's worked just exactly the way that Dr. Patel has presented it. When we went into it, one of the things we looked at, there's different models of what Dr. Patel has in place. But the one thing that we were, I guess, smart enough or fortunate enough to do was to stay with the proposal as presented by Dr. Patel, in that it's not associated with an existing community medical provider. That comes back over and over. And I didn't really understand that until we continued to talk. But the ability not to be constrained by community ties has allowed this organization to reduce those costs and look out for our people. The other thing, as an employer, I always looked at how much are we spending per individual going to the doctor in the hospital and whatever. And that's where I was focused on. But listening to Dr. Patel, you want to focus on those people that don't get to the doctor because they can't afford to go there. I really never thought of that. When I was bargaining with one of our units one day, I was taught a lesson very quickly by a gentleman in our custodial maintenance group. And he sat across from me and he said, you know, I'm insured. I know we have to put so much money towards our insurance package. He said, I'm insured, but I can't afford to use our insurance. And it was like, what do you mean? I can't afford to take my 4 kids at $25 a copay. I can't afford the $10, $20, or $30 copay for the medicine, even if I get in to see the physician to make them well. And I'm thinking, there's got to be some other way. This answered that question. It totally did. The participation has far exceeded even what Dr. Patel and his group in their wisdom said we would be able to get. Our people love it. If you tried to take any benefits away, and I'm speaking now as a former director, but I think I still speak fairly succinctly to this point, there would be a riot in this particular employee group if you tried to remove the clinic or the wellness center. I still go back to a term, the wellness center, from their ability to access. It means that much to them. And it has become even more of a critical player with time constraints, productivity in education. We're being held to a different level of accountability, and this all plays back into that. Not only is it giving people a better quality of life, it's enabling them to sustain their level of productivity to have that life too.
So you would agree with me that all the barriers of access have been removed? There's really no excuse for somebody now.
There is no excuse for individuals to have, that if they are having a need to get to this clinic, to be seen, to be treated, and hopefully not to come back. We're not in the business of saying, you know, if Dr. Patel, if you get Jim in here, have Jim come back next week and have him come back the following week because we want you to keep billing. It's just the opposite of that. We want you to get Jim in here, you fix him so that he doesn't come back next week and the following week and the following week. And that's what is occurring.
Because you're paying really for that person one time, not every time that he keeps coming back. So you encourage him to stay well and to stay on top of his health, because catastrophic health care on the other end, if he doesn't take care of himself, heart disease and all those things, he could have prevented had he gone to the clinic in the first place.
Then that gets into our insurance, and then that goes into our big insurance corporation, which negotiates rates which are going to be not in our best interests.
Right.
Not at all. So we're paying him to keep those people on the job.
So if you were talking to the human resources directors back in Georgia, because every school system now, you were saying earlier, is facing the same rules of how to play the game. Teachers can't miss class because they have accountability steps in play. What would you say to them would have been the two biggest reasons why you decided to advocate to your school board to go forward with this?
One is that the productivity. That in education, in public education specifically, we have got to step it up. It's being expected, it's being demanded, and it's being dictatorially put down on education. To keep our teachers in the classrooms, to keep everybody in their position and being as productive as possible. That is critical. But then just the human factor, we want to provide the best possible environment for our employees, the best, and that means physical care. And not only physical care, there's so many things. When I go see my private physician and I get my 2 minutes or 3 minutes, it's like, what's wrong with you? Well, I got to know what's wrong with me to tell him or her, whatever. And then here's your prescription and go. To spend 20 minutes sitting down and talking about not what's just wrong with me right now, but what's led up to this and what are other factors. It's a total package that we owe our employees. And if we can get that, and we can, at a greater savings, everybody wins. Everybody wins. And so it is an answer to one of the problems that as HR director you have to face. How do you keep a good, healthy employee productive as much as possible? And you're not only worried about that particular employee, but how does the family? If you are Mrs. Jones, teacher in 3rd grade class, who has little girl Sarah, 4 years old, at home, sick, and you're worried about her, you're not thinking about what you're going to be doing in the classroom that day. You're thinking about, how do I get my little girl to the doctor? I have to take time off, I have to make the appointment, I have to go get the medicine, and then I have to hope that it's good quality care and everything else is taken care of. With the wellness center, we have times outside of the school day. There's no reason for that teacher to miss. That teacher's in the classroom. And their time in the classroom is going to come back on their evaluation, which then is going to depend upon how much money they get or whether they keep their job. And so it's never been more critical in public education to keep teachers in the classroom. And they're now understanding we have to be in the classroom. Our survival depends on it. And so if my health can be taken care of by my employer at a greatly reduced cost to both the employer and to me, why not? It's a no-lose scenario. I mean, you can't lose with this system.
Great. Jennifer, you're managing it all now. You get feedback from employees, I'm sure, and you also have to recruit new employees. Do you use these tools to recruit new employees, or do they seem to already know about it when they come here, or what's the advantage now that you think it gives your county over other counties to recruit, top teachers and administrators, knowing that they can have this access to care?
Well, employees that are at different organizations, a lot of times they want to get more information about it, see if they can have Dr. Patel come and speak with them and have that availability. Some of them are too small, and I know you've combined the county and some other companies so that they can do that. Inside the organization, it is one of those rare things when it is a win-win, and it is. And we get very positive feedback. I get a lot of emails about the physicians because there's consistency. They see the same physicians all the time. So I get feedback about the physicians, I get feedback about the hours, and everything's positive. The negative that we've ever had is because someone couldn't get a prescription there because it's only brand, and we carry generics. So it is one of those things that I'm very proud of. I like to go out and be among the employees because this is the one thing I can lead off with, a very positive note. This is a benefit for you. Take advantage of the benefit.
Right. That's great. Dr. Patel, you have anything you want to add to what's been said? I think that it's a great testimony to your idea and how you were able to bring this all together and make it work. And just sitting here, I know that they volunteered to come here today and to sit down with me and talk about the success. What other things do you have in store? Can this model be spread around the country? Is it just because the rules or the laws here in Indiana have allowed you to do it, or can other people take advantage of this as well?
Actually, if we go back 15, 20 years, these models have been tested. The federal government, the CMS, has pilots already out, and demonstration projects have been implemented to create what they call the medical home. But really nothing has stuck, or no one has taken a lot of initiative to put it together. This is sort of a medical home model in a watered down version to start with. This is a framework. Now we can start adding the pieces together, which we will start talking about in the future to say, what can we do over the next 2 years? And there's a lot of pieces that we can now plug in, but first we need to have that framework, and this is the framework. The framework that's functional and financially viable to go to the next couple of years. But as we start adding, some of the plugins that we'll add is really to ensure that the providers that we are referring to are the top 20% of quality providers in the nation. So then they will have options to sort of choose the providers, keeping the cost the same or lower, but go to the best provider. At the same time, we started recently doing house calls, again trying to eliminate the need to go to the ER. I've worked in the ER for 15 years, and I can tell you 30-40% of the patients that come in don't need to be there. When you ask them why are you here, they'll say the same story. I don't have a doctor, or I can't find my doctor, and they're there, and you don't blame them.
Or it's a weekend, the doctor said go to the ER.
Exactly. So, but what if we were to service the patients? Then really we should have a on-call physician assistant or a doc that can actually make house calls. And if we can save an ER visit, that should be the way to go.
Very good. Is there anything either one of you would like to add before we close out?
I think the one thing that we started out thinking the clinic was going to be more of an urgent care facility that people would visit at one time for a cold or whatever. But with our population, I think they've actually, between Ken, the PA, and Dr. Patel, these guys are now their primary care physicians. And I don't think we expected that. We hoped that, because that's where the wellness component comes in. If you see them and know a lot about their health, then you can help steer them in the right direction. But I think when we started out, we never really had the thought that it would become such a piece of their health insurance as where they would consider him their physician now.
So there's a level of trust that's been built.
Absolutely. It is not just an urgent care facility.
Very good.
This is a different model. It's one that is, in terms of my lay perspective, a radically different departure from what normal health care and how health care is provided in a community. There will be aspects of any community, because we may be different, but we all have similarities, that will not want this to occur. And a good HR person or a good board, a school board that gets involved with this, will have to look beyond that, beyond the politics, and say, this is the best for our employees. Now, healthcare has not changed on its own. We're paying the bill. We're going to change it. And I think that's the one thing as an HR person or employer, you pay the bill. It's time that you need to start exercising that authority with some good, prudent judgment in terms of healthcare for your employees. It can happen, but it will come with some cost of pain. Nothing has changed without a little bit of discomfort, and this will create discomfort. But in the end, it's so much worth what you have to go through to get it.
Climb that mountain, when you get to the peak, you see the beauty down the other side.
That's true.
Absolutely.
Yeah.
That's true.
Well, very good. We appreciate you all being here today.
Glad
Thank
to.
you.
Is it okay to say y'all in Indiana?
Y'all fine.
Y'all, that's right.
That's great. Thank you.
Thank you.
Appreciate it.
Thank you.
Thank you, Doc.
All right.